Hi everyone, I'm Dr. Lynn Wagner. Today's video is a fun one because it's all about taking care of your hair. And there's more than just your hair involved. You have to think about your scalp, you have to think about your body. And the cool thing about this is I'm going to have a little cheat sheet for you. So if you need to look at all of these different steps you can take to take care of your hair, it will be linked with this video. So let's get started. So when you're thinking about taking care of your hair and preventing hair loss, you want to think about your scalp first. I didn't think about my scalp for years, but it makes so much sense. Your scalp will build up dead skin cells, impurities, build up. And if you don't take care of that, it's going to block those hair follicles so that the hair cannot come out. So scalp health is really important. And there's two specific things that I do and recommend to my patients to take care of your scalp. The first thing is exfoliation. So if you've ever exfoliated your face, you know what that means. You're getting rid of dead skin cells. You're putting an abrasive substance on there to help kind of sandpaper off your face. And you want to do the same thing with your scalp. There are multiple products out there. I will link them in the handout. And basically about once a week, depending on how oily you are or how dry, you're going to want to apply a scalp exfoliator directly on your scalp, not on your hair, and then rub it in with circular motion for about 3 to 5 minutes just to kind of get all that dead stuff off and the buildup off. It's really easy. There are a lot of inexpensive products out there, but that is really important. It's something I have noticed personally has made a big difference. The second thing that I think is great is actually scalp massage. So if you go on a place like Amazon, you can find these little nubby plastic things that will literally massage your scalp because as we talked about in the other hair loss video, circulation is really important. You want your blood vessels to bring all of those important nutrients to your hair so that it can grow. And if you don't have good blood flow, that's not going to happen as well. So you want to actually massage your scalp to encourage healthy blood flow to the scalp. And that can be done several times a week. I typically do it when I shampoo, which is about 3 times a week. And I spend about 3 minutes just doing a circular motion with the hair massager in every single section of my scalp. It also just feels really relaxing, so I like that as well. So that is how I take care of my scalp. There are other things you can do with your scalp in terms of treatments, and we'll talk about that later. The next thing you want to think about is actually taking care of your hair shaft. So you want to give it those nutrients and the protein and all those things to help that hair grow. My favorite is actually collagen. At the clinic, we use a product called Tranont, which is type 1 collagen. Type 1 collagen is the collagen that is going to give you healthy hair, skin, and nails. It is a liquid product. I love it. There are great powdered products out there as well that have both type 1, type 2, type 3, other forms of collagen. But if you're looking specifically for hair, skin, and nails, you're going to want to go straight for a type 1, and that you're going to want to take every day. You also want to look at your nutrient status. So one thing I see all of the time in my clinic is people who have iron deficiency and are experiencing hair loss. So you want to check obviously your iron and your ferritin, but even things like vitamin D, your B vitamins, your zinc, your magnesium, these are things that you should check because all of those things can contribute to the growth of healthy hair. And then lastly, you want to think about your protein consumption. So I'm big on protein, obviously for gaining muscle and protecting your bones, but it is also very important for hair. So you want to get the right amount of protein, and that's going to be different for everyone and should be discussed with your integrative doctor. We already talked about circulation, so let's move on to that. So we talked about boosting circulation with the massage. There are also medical therapies you can use that will boost circulation. So most of us have heard of minoxidil or Rogaine, which is the over-the-counter product that you apply on your scalp once or twice a day. That is a really nice option if you want to bring more blood flow to your scalp. The only issue with is if you stop it, you're going to lose all of the hair that you grew. And also, as a woman, I really don't want to be putting a solution on my scalp twice a day and maybe not even once a day. So the nice thing is that there are oral forms of this drug available as well. There are side effects, and you want to make sure you're working with a doctor who knows your medical history and that it's safe for you. But there are oral versions of this drug as well. For women specifically, we actually use a compounded form because it has to be a pretty tiny dose. But it is a great option if you are worried about hair loss to your scalp. And then the other thing in our clinic we use is we use an essential oil do-it-yourself blend, which I will put in the handout. You can use things like rosemary, lavender, tea tree. Those will help improve scalp circulation. They have other things as well that will help with hair growth, but that's a really nice natural thing to do since the scent is nice, and that's something maybe I wouldn't mind as much putting on my scalp at night. And then there's hormonal support. So we've talked a lot about how that hormone DHT can cause loss of hair through the shrinking of your hair follicles. You can block DHT in multiple ways. So there are natural ways to block the hormone of DHT, like saw palmetto. There's ketoconazole shampoo, which is actually like an antifungal shampoo, but it has weak DHT blocking properties. So I will have patients apply that to their scalp in a prescription strength, not the over-the-counter strength, about 2 or 3 times a week. Let it sit, rinse it out, continue to wash and shampoo and conditioner as you normally do. That can work really well. And then if it's a really bad DHT issue, you can actually use prescription medication called dutasteride, which is very strong. The problem with dutasteride is you don't want to block your DHT too much because DHT is a very powerful androgen or male and female sex hormone. So you don't want to tank it all the way to zero. So you want to work with someone who's actually looking at your DHT levels, making sure you're not blocking it so much that you don't have any in your system, and kind of getting you to that sweet spot where you're not losing hair, but you also still have some DHT on board. And then there's spironolactone, which I don't use that often. I'll typically use that more for acne, but that is another option that you can discuss with your provider if nothing else is working. And then you can move on to like those advanced at-home options. So these are things that if you're already doing the other things and you're still experiencing hair loss, or if you're just someone who wants to make sure that you maintain healthy, beautiful, shiny hair well into your older years, you can do things like red light therapy. I am a huge fan of red light therapy. They actually make hats that you buy specifically meant for hair loss. I personally will just use my red light panel that I use for the rest of my body and put my head right in front of it. Sometimes I'll use my Omnilux face mask that is meant for your face, but I'll literally put it on top of my head. So any type of red light therapy is going to give you amazing benefits. And that is an easy thing to do 4 or 5 times a week, 10 to 20 minutes, and you can do other things and multitask while you're doing it. There are fancy peptides that are out there that work really well for hair loss. We specifically use one called GHK copper, which it can be in a foam or an oil. You can pair it with other peptides that are meant to prevent hair loss. That works really well, but again, that's something you're going to be applying more regularly, like the Rogaine or minoxidil. And then there are proprietary blends available from companies like OneSkin, Kilgore MD, Hair Prescriptives. There are so many different products out there that will support hair loss, but you're going to want to go to the first things I talked about first and then advance on to these more advanced options just if you want better hair or if you're not getting results with the first steps. And then lastly, one thing we offer at Wagner Integrative Health, and you can get anywhere that they offer hydrofacials, is something called Caravive. So that's going to be a deep cleansing, growth factor infusion, exfoliating all in once. You do it in 3 sessions, and then you do a maintenance every 3 to 6 months. So it's pretty hands-off, and we do see great results with that as well. Again, that's Caravive by the company Hydrofacial, and any place where you have an esthetician who is doing good work is going to have that at their disposal like we do at Wagner Integrative Health. So with that being said, here are the simple tips. Start from the foundation up, take care of your scalp. Don't do everything at once. So all these things that I said, if you try to do all these things, it would be a full-time job. So obviously don't do all of them at once. Start with one, maybe add another. At the end of the day, maybe you're doing 3 things that are helping you to either maintain your hair or prevent hair loss or regrow your hair. And then track your progress with photos. So if you start something for hair loss, don't expect to notice a difference in 2 weeks, 4 weeks, even 2 months. Hair takes a long time to grow. So I tell my patients, you want to wait at least 3 months and most likely 6 months before you make a call on whether or not the thing that you're using to grow your hair is working or not. And a great way to do that is take some photos, have a loved one take a photo of you from the top, and that way you can actually document if it's working or not. If it's not working, move on to the next step. And again, work with a provider who knows what they're talking about. Hair loss is complicated. There's different types. It's different based on your sex. It's different based on what age you are, what your hormones are doing. So you want to work with someone who's looking at the entire picture, the holistic picture, so they can help guide you to healthier, better hair. Thanks for listening.